transcatheter pulmonary valve replacement is a procedure used to replace the pulmonary valve and treat pulmonary valve regurgitation without need for open heart surgery. I'm Dr. Matthew Gillespie, an interventional cardiologist in the Pediatric Heart Valve Center and director of the Cardiac Catheterization Laboratory. My team is one of the most experienced in the country, and we regularly perform transcatheter pulmonary valve replacements. To better understand the procedure, let's first take a look at the anatomy of your heart. This is your heart. It has 4 chambers and 4 valves. Blood passes through a valve before leaving each chamber of the heart. Heart valves are made of flaps of tissue called leaflets. These leaflets work like one-way doors, opening to let blood move forward and closing to keep blood from flowing backwards. The valves prevent the backward flow of blood. The heart's lower chambers are called ventricles. The left ventricle pumps oxygen-rich blood through the aortic valve and into the aorta, which is the largest artery in the body. Blood travels from the aorta to blood vessels throughout the body, delivering oxygen and nutrients. Blood that has traveled through your body and is now low in oxygen goes into the right side of the heart. The right ventricle pumps the blood through the pulmonary valve into the pulmonary artery and into the lungs to receive more oxygen. In children and adults with pulmonary valve regurgitation, not all the blood pumped out of the right ventricle goes into the lungs. Some of it flows backwards and re-enters the right ventricle. This forces the right ventricle to handle extra blood volume and to work harder. Over time, this extra volume and work can stretch and damage the right ventricle, which can lead to right heart failure. A transcatheter pulmonary valve replacement is a non-surgical procedure used to replace the leaking pulmonary valve with an artificial valve delivered by catheter through the body's vascular system. Self-expanding valves like this one are made of fabric and a special kind of metal. The metal is elastic, so you can fit it into the delivery catheter and then expand it once you reach your target site. Your interventional cardiologist will review your individual anatomy to choose the best size and type of valve for your body. Here's how the procedure works. During a transcatheter pulmonary valve replacement, the artificial valve is compressed and loaded into a catheter delivery system, which is then inserted into a vein in the leg. The catheter is then guided through the vascular system and heart like a train on a track. Once the valve is in the intended location, it is released from the catheter where it locks into position and begins to function. Your interventional cardiologist will then remove the catheter and run a few tests to ensure that the valve is working properly. Then the access site in the leg is closed. The entire procedure takes approximately 2 hours. Because a transcatheter procedure is much less invasive than an open heart surgery, most patients recover quickly and can typically return to their usual activity within a week. Just like each child is different, so is each heart. The Pediatric Heart Valve Center at CHOP uses advanced imaging to clearly visualize a patient's heart to help make the best possible treatment plan for your child.